It can happen suddenly. A tight pressure in the chest, pain spreading to the arm or jaw, shortness of breath, and within minutes, it can become life-threatening. This is called a heart attack, and it occurs when the heart muscle is suddenly deprived of oxygen. So what actually happens during a heart attack? A heart attack, medically known as a myocardial infarction, occurs when the blood flow to a part of the heart is blocked. The heart muscle needs a constant supply of oxygen-rich blood to function. When this supply is interrupted, the affected part of the heart begins to suffer damage. In most cases, the blockage is caused by a blood clot forming in one of the coronary arteries, which are the blood vessels that supply the heart. These arteries can become narrowed over time due to atherosclerosis, where fatty plaques build up inside the artery walls. If one of these plaques suddenly ruptures, the body responds by forming a clot at that site. This clot can partially or completely block blood flow. When the flow stops, oxygen cannot reach that part of the heart muscle, and within minutes, the cells begin to die. The symptoms of a heart attack can vary, but common signs include chest pain or pressure, shortness of breath, sweating, nausea, dizziness, and pain spreading to the arm, neck, or jaw. In some cases, especially in women and older adults, symptoms may be less obvious, such as fatigue or mild discomfort. A heart attack is a medical emergency. The longer the heart muscle is deprived of oxygen, the more damage occurs. Quick treatment is critical to restore blood flow and reduce injury to the heart. Risk factors for heart attacks include high blood pressure, high cholesterol, smoking, diabetes, obesity, lack of physical activity, and stress. These factors contribute to the narrowing and damage of blood vessels over time. The understanding of heart attacks has improved significantly as scientists studied how blood flow affects the heart and how blockages form in arteries. Treatment focuses on restoring blood flow as quickly as possible. This may involve medications to dissolve clots, procedures to open blocked arteries, or surgical interventions. After recovery, lifestyle changes and medications are often needed to prevent future events. Modern technology is also playing a major role in heart attack care. Artificial intelligence and machine learning are being used to analyze heart data, detect early warning signs, and assist doctors in making faster and more accurate decisions during emergencies. A heart attack is a serious condition that occurs when the heart's blood supply is suddenly blocked. Understanding what happens inside the body during this event highlights the importance of early recognition, rapid treatment, and long-term prevention to protect heart health.